both men and women have DHEA. So between estrogen, progesterone, testosterone, DHEA is actually the most abundant. That's really, really important. As we age, we start to lose the ability to make DHEA. Hey everybody, welcome back to another episode of Daily Doc Talk. I am your host, Dr. Drew Timmermans. Recently, I had a question on my Ask Me Anything Monday Instagram where the question was the importance of DHEA and furthermore, what my optimal lab values are. So before we get into labs, I want to briefly talk about DHEA. So DHEA, not to be confused with DHA, which is an omega-3 fatty acid, but DHEA is a hormone that is made in both men and women and serves really important roles, both directly and indirectly. So like all other hormones, the starting precursor for DHEA is going to be cholesterol. That cholesterol is going to go through several different steps before it becomes DHEA. Now, DHEA can kind of be considered and has been called the mother of all hormones because in terms of the reproductive hormones, so testosterone and estrogen, it gives rise to all of those. And so it's the central hormone that can give rise to all those other different sex hormones. And so it's important in that sense, in that it's the precursor to all of the other sex hormones, testosterone, estrogen, things like that. And so, but additionally, on top of that, there is also some research suggesting that there are direct effects of DHEA on the vascular tree, the vascular wall, so helping with kind of atherosclerosis and preventing that, but also our immune system. And so aside from DHEA having the effect of being a precursor into other hormones, DHEA is also suspected to have an actual direct effect in our body, which is why it might be important to supplement with it or to optimize those levels if they become deficient. So in terms of deficiency and kind of what I consider the optimal ranges. So before we get into that, the first thing I want you to know is that a lab reference range is good at identifying extreme diseases, but it is not good at identifying what is functionally optimal. And so within that large lab range, I have for a lot of biomarkers, almost all hormones, I have optimal ranges that I look at when I'm working with patients. This doesn't dictate exactly how I'm going to treat a patient because the treatments for my patients are going to come largely based off symptoms. However, if a patient has symptoms of androgen and DHEA deficiency and their lab values are within the optimal range, my optimal range, but on the very low end of the optimal range, that treatment approach is going to be a lot milder than if someone is outside of my optimal range, but still in the normal range for the actual lab. So they're going to be further away from what I would consider an optimal value. And so the labs can help determine how aggressively or strongly we need to look at treatment. And maybe it might be the differentiator between saying, okay, in terms of our options for lifestyle, nutrition, herbs, supplements, and hormone replacement therapy, it can help to define that treatment and give us some guidelines on where we should go. So the other really important thing is that both men and women have DHEA. And so it's important for women to also understand that. The other really, really big thing to understand is that in the blood between all of the androgen or all of these sex hormones, so between estrogen, progesterone, testosterone, DHEA is actually the most abundant. That's really, really important because as we age, we start to lose the ability to make DHEA. On a conservative level, it's probably about, as we age from age 20 to I think about age 60 or 70, we lose about 20 to 30% of DHEA. However, I've had patients walk in my door who have lost a lot more than 20% of their DHEA stores. And so if that's the most abundant hormone floating through your blood, then losing 20 to 30% of it on a conservative side is a huge deal, because you, on a relative sense, you're losing a large percentage of your total hormone pool. That's important because that DHEA that's made in the adrenal gland actually circulates through the blood, goes into the cell, so into your muscle cell, adipose cell, whatever other cell it needs to, and that's where it can get converted into testosterone. And so if you have a reduction in the circulating levels of DHEA in the blood, there's a potential for you to have a androgen deficiency, because that DHEA is not able to get into the cells and convert into testosterone as much because the levels are lower. It can still do it, but it's just happening at a decreased rate because there's less of it. And so looking at DHEA levels is really important, because like I said, if we lose 30% of your total DHEA, you've lost close to 20% of your total hormones in your body when we're talking about the adrenal and the sex hormones. That's a lot. And so in terms of lab values, my optimal lab values for men are going to be between 380 and 420 micrograms per deciliter. So that's American units. I apologize, you'll have to convert if you are not in the US. Easy to convert. And then for women, it's about 280 to 320 micrograms per deciliter. So that's where I like my patients to be. But again, if they come in and they're at, let's say a man comes in and he's at 300 micrograms per deciliter, but he has no symptoms of DHEA deficiency, testosterone deficiency, androgen deficiency, then I'm not going to force him to take DHEA or do something that's going to increase that value, because he doesn't have any symptoms. And the same goes for a woman, and the same goes for excess. If a patient comes in and they're at 450 for a man, where my optimal range, high-end range is 420, if they're at 450, they're not supplementing, they don't have any symptoms of excess DHEA or excess androgens or testosterone, then I'm not overly concerned and I don't have to do anything to reduce it. Now, if a patient comes in and they've been supplementing and they're pushing 500, 600 micrograms per deciliter in a man or woman, then that is definitely of concern, and we want to use the labs to reduce the treatment, reduce the amount of supplementation they're doing in order to bring those values down. So to recap and tie this all in together, DHEA is an important hormone in both men and women. It has direct effects on the vasculature, on the endothelium, as well as the immune system. It also has indirect effects throughout the entire body, because that DHEA gets taken up from the blood, goes into the cells, and can get converted into testosterone, where the testosterone exerts its positive effects. And then in terms of lab values, while this doesn't dictate treatment, it does help guide. My optimal values for men are going to be 380 to 420 micrograms per deciliter, and in women it is 280 to 320 micrograms per deciliter. All right, everyone, thanks for listening. If you have not subscribed, whether this is YouTube, Facebook, LinkedIn, wherever, please subscribe. Leave a comment below. I'd love to hear from you, and see you later.